Healthcare issues for me continues to be about affordability and access. Some people have great access to hospitals and primary care physicians, and then others don't. And it has a lot to do with where you live. So I serve Colorado, and so a bulk of our state is rural. And when you go into our rural areas, the hospitals and providers are working on very slim margins, and their access, if you live in a rural area, sometimes you have to travel far to get the kind of services that you need. So telehealth continues to be an issue that I'd like to see that we expand. That has been very helpful during this COVID season that we've been in. And just more scope of practice, expanding that to make sure that people in some of these remote areas have access to people that have the credentials to kind of do the work would be some areas of concern, as well as my concerns as it deals with pregnant women, postpartum, and just access and more access. I believe that health equity is not just an issue that belongs to people that provide health services for our state. I think we have to make sure that we have a lens of equity in housing and how we deal with housing crisis. I think it's important that we have a health equity lens as it relates to policing, because we can't be policing people who are dealing with behavioral health issues, and we can't think that our prisons are places to house people that have behavioral issues or even people that have substance abuse. So I think we still need to be mindful about behavioral health issues and how we're addressing those across our state. Now, we've done a great job of coordinating it, but still the workforce development access. How do we get professionals in the pipeline to provide the services that we need, not just for behavioral health, but all across oral health and physical health. There's just great need for workforce development. That has to be a major concern in 2023.